Good morning. My name is Regina O, and my evidence-based project proposal topic is the effects of breast cancer on the mother and baby during pregnancy and long-term effects of after treatment or non-treatment. And here is my table of contents. All right. So on my introductory part, I'm going to be, I'll quickly define what breast cancer is and some of the effect it has on, you know, if there is need for treatment or not. So, but first, let me define what breast cancer is. We all know that breast cancer is a prevalent health concern that is affecting women worldwide. And when diagnosed during pregnancy, it can present a unique challenge for both the mother and the healthcare professionals. And that's because some of the challenges and complications that comes with being pregnant and also being diagnosed with breast cancer. you know this dilemma can affect the woman psychologically, affect the baby developing organs, and even cause some child defect. Now, some of the symptoms could include breast changes and tenderness, or even redness and swelling. And now, because the symptoms are overlapping with pregnancy symptoms, it presents like a dual responsibility for the mother, for the woman who is pregnant, to actually know the difference between breast cancer symptoms and pregnancy symptoms. And because of this, it could lead to like a delayed diagnosis. It could lead to like an advanced stage of the cancer even before detection. And so some of these complications could, you know, make the mother or the healthcare professional be faced with like a dilemma on the kind of treatment to administer, and also know the best decision to make. But it is also very important to note that every case is unique, and decision requiring breast cancer treatment during pregnancy should be made in consultation with like the multidisciplinary team, which would involve the oncology, the obstetrician, the neonatologist, because the end goal is to provide optimal care for both the mother and developing baby. So yes, it is crucial to be informed, and in order to make you know make a proper decision. So all the stakeholders and all members of the interdisciplinary team need to come together for the proper management of breast cancer during pregnancy. And also there is a requirement for careful consideration of the potential risk and benefits of various treatment options to ensure the best possible outcome for both the mother and the baby. All right, so the significance of the problem. Looking at the effects during pregnancy on the part of the mother, the long-term effects can vary based on the stage of the cancer and the type of treatment the mother received while she was pregnant. And on overall health, the mother may experience some physical and emotional challenges such as fatigue, pain, lymphedema, and psychological distress. And for the baby, the effects on the baby could definitely depend primarily on the kind of treatment that was administered to the mother during pregnancy. Research suggests that the majority of babies exposed to chemotherapy drug during their second or third trimester do not, show some developmental abnormalities. But however, there are some specific treatment plan that may pose some health risks to the babies life, such as certain chemotherapy drugs, which can potentially harm the developing organs and cause some child defects. However, in most cases, appropriate treatment can be administered with minimal harm to the baby. Now, we also know that breast cancer during pregnancy presents like a complex situation, and that causes a significant challenge for both the mother and the baby. So, after significantly identifying the problem, there is a need to create like raise awareness, promote collaborative care, advance research, provide supporting care, and also implement long-term monitoring. And these situations offers a unique opportunity to for like positive change that can improve outcome and the overall well-being of affected families. Okay, so on my project question, I'm going to be breaking it down into the PCOT. But first, let me quickly read out my project question. In pregnant women diagnosed with breast cancer, how does the timing of treatment during pregnancy or after childbirth impact maternal survival rates, neonatal health, and long-term effects on both mother and baby within a 5-year follow-up period? Now, breaking it out into PCOD, my population is going to be pregnant women diagnosed with breast cancer, and this just clearly defines the specific group of individuals the study is going to be focused on. And the intervention, which is the timing of treatments, is just going to be talking about like comparing two different treatment timings in pregnant women with breast cancer during pregnancy and after childbirth. The comparison, I'm going to be comparing, it's going to be between two groups, and it's going to be the pregnant women who receive treatment during pregnancy and pregnant women who receive treatment after childbirth. And then the outcome is going to be measuring three main outcomes, and they're going to be like checking or looking at the maternal survival rates, the rate of survival among pregnant women with breast cancer who undergoes treatment during pregnancy compared to those who receive treatment after pregnancy, and the neonatal health, looking at the health and well-being of the newborn of pregnant women who receive treatment while pregnant versus those who receive treatment after childbirth. And then the third one is going to be the long-term effects on both the mother and baby with a 5-year follow-up period after treatment. The timing is going to be like to follow the participant for a period of 5 years to assess the long-term effect on both mother and baby. Okay, so the literature review presented a valuable insight into managing breast cancer during pregnancy, and also the review included a lot of diverse study designs like the cohort studies, the case control studies, and systematic reviews, and all collectively yielded a comprehensive understanding of breast cancer impact on pregnant women and their infants. And the database that I used mainly I used the CINO and the PubMed. All right, so from all the literature review I went through, and now I'm going to be like looking at the summary of the evidence. And so basically it looked at how early stage breast cancer studies reviewed comparable maternal survival rates between women receiving treatment during pregnancy and those delaying treatment until after childbirth. So the reason for implementing a multidisciplinary team approach, and which requires collaboration among different medical specialties. Even though most organizations already have this collaborative effort into place, it is very important to note that they have to establish clear protocols and communication channels that can facilitate successful implementation. So, in summary, the research and treatment advancement also depends on funding and research initiatives and participation from the patient. You know, conducting clinical trials that involve pregnant women that are faced with this challenging dilemma due to ethical consideration, and dedicated research and efforts need to be put in place in order to gain a valuable insight and safer treatment options. So, in other words, there is a need to establish long-term monitoring programs that can be readily incorporated into post-treatment follow-up and for both the mother and the child. And of course, regular checkups and assessments should be a routine. And also there is need to ensure that potential late effects are promptly identified and addressed. So, under the recommended best practice, acknowledging the significance of personalized treatment decision is crucial in considering the recommended best practice. And we're going to be looking at the factors like cancer stage, gestational age, and maternal health before we can, recommend best practice. Now, based on the evidence that is made available, there is need for personalized management of breast cancer during pregnancy, because you have to put into consideration the patient-centered care and also their cultural preferences. So before any recommended best practice is put into place, there is need to know when and how to intervene, and at what stage you should start the treatment, and also know if it will have a negative impact on the well-being of the developing baby. And with all of this, you can now put into place the best recommended practice, putting the mother and the baby into consideration. And on policy and protocol for practice change, the success should largely depend on collaborative efforts among the stakeholders, including healthcare professionals, institutions, policymakers, and even the patient advocacy group, by prioritizing the health and well-being of both the mother and the baby. The plan change would now have a potential significance to improve outcome and enhance the quality of life for pregnant women with breast cancer. And the success of any plan change that would affect the policy and protocol may vary depending on the specific regional healthcare system, cultural factors, and available resources. So there is need for continuous monitoring, evaluation, and adaptation of strategies are all, essential to ensure the best possible outcome before considering the type of policy and protocol that should be put in place. The implementation process will be divided into phases in order to enable ongoing evaluation and get feedback. And also, there is a need to conduct a need assessment to, know the gaps between breast cancer during pregnancy, and also develop a detailed plan based on the identified needs, and then, of course, the best approach to take. Also, there is need for regular scheduled meetings and educational sections in order to provide a comprehensive implementation of the planned action. And on the part of the evaluation, it's going to be drawing on different factors and metrics such as like the survival rate, the incidence of birth and complication, neonatal developmental milestone, and of course the long-term effect on both the mother and infant. Overall, the potential for managing the breast cancer during pregnancy appears promising. While certain challenges may arise, there is a need to, put into consideration some ethical issues and, also by adopting evidence-based practices and promoting a unified multidisciplinary efforts could also help lead to a well-informed decision, and this could help bring out the best practices and policies that could help the healthcare providers to work together to improve the quality of care and enhance the lives of pregnant women diagnosed during pregnancy, and also ensure the safety of their baby. Here are my references. Thank you.